Boop, 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 boop. Yeah. So everybody just know you touch, it's on.
It is on, yes.
Okay, alrighty. Good morning, everyone. We'll call to order special meeting of the Douglas County Board of Health, June 2nd. For the public, there's a copy of the Open Meetings Act here in the room. Note to everybody, this is being live streamed on YouTube, and the purpose of the meeting today is for a second round public interview of our finalists for the Health Director, Dr. Lindsay Huse. We do have 5 people here in attendance for a quorum, and so just for the public, tonight at 5:30 here in this room, there will be a public meet and greet for Dr. Huse, so we'll save that to then for her to introduce herself more in detail with bio and other things. Today, we'll pretty much get straight to the questioning, and note to the public, these questions were asked from community stakeholders that will be working with the health director, and with that, we'll head right into question 1, and then we'll go around. So Dr. Huse, good morning. How are you doing?
I'm doing great, thank you.
Alrighty. Can you pick her up in her microphone? Just look. Okay. Dr. Hughes' first question is, number one, what do you see the role of the what do you see as the role of the public health department?
The Public Health Department has an extremely important role in our communities. You know, in order to ensure that everyone is able to pursue happiness, there has to be a basic level of health that everyone can achieve. And that really is the basis for public health, to really address that foundation of ensuring that the environment that we're all living in, regardless of who we are, is an environment that is conducive to attaining health. So that really is the overarching goal of Public Health Department.
Okay. Question number 2 will come from Ms. Espinosa.
Good morning, Dr. Huse.
Good morning.
It's a pleasure to meet you.
You as well.
Question number 2. As you know, Douglas County is one of the most diverse counties here in Nebraska, and we would just like to know your experience on serving community of colors, and just give us a few examples on how you have approached social determinants of health within the communities that are underserved.
Wonderful, thank you. Well, I can say that throughout my entire public health career of 20 years, I have been working with a variety of communities, including communities of color. When I worked at the Lincoln-Lancaster County Health Department as a public health nurse, which was some time ago now, we had the wonderful opportunity to serve a huge variety of different people. At that time, I believe Lincoln Public Schools served 54 different languages spoken in their school system. And when I first came into that position, I actually was the sole public health nurse, or actually the sole medical person out at the Juvenile Detention Center down in Lincoln, and had a variety of kids who came in, many of whom were kids of color, and really was able to start out seeing what kinds of struggles they encountered, what kinds of impact racism had in their lives, and really understanding, and it really drove home for me the need to address those social determinants, to really make sure that those kids at some point had a much better future and were able to pass that better future on to the next generation. I definitely look at equity in everything that I do. Recently, we decided in Wyoming that our nurse home visiting program wasn't a good fit for Wyoming, and part of that was that the home visiting program that we had in place only served moms with one child. So basically, if you were having your first baby, you could get home visiting services, but any babies beyond that, you didn't qualify for those services. Well, we know that a lot of our Hispanic communities, other people of color have bigger families than that. And so it's really a disservice to only give a service to somebody for their first child. So even though that system had been in place for 23 years, I scrapped it, which was a very difficult and at times a little bit contentious decision, and found a new model that really would better serve all people. So the new model that we're implementing really can serve as many children as a family has. And so really being able to reach people who need those services much more than, just the first time around, essentially. And really, we look at equity in our policies. When we wrote our recent state health assessment, we ensured that we built in language around equity into most of our measures. That was a first for Wyoming. So that was an interesting challenge for us, but we were able to really start bringing that issue up in an environment where possibly it hadn't been discussed as much.
Thank you.
For question 3, we'll go to Councilman Gray, and we'll just work our way around.
Good morning.
Good morning.
How are you this morning?
Very well, thank you.
Good. I can almost talk without this. So you can.
I can hear you great.
Anyway, question number 3. What is your opinion regarding expanding the role of public health department to address less traditional issues like mental health, racism, and loneliness?
What a great question. Thank you for that.
No, it wasn't me.
But you did a beautiful job presenting it.
Thank you.
So, public health changes. We have a foundation, but the issues that face our populations don't remain stagnant. So why would we remain stagnant? I think it's very important that we flex and that we are able to, adapt to what the needs of our community are. Not just do what we've always done because that's what we've always done. It's always important to evaluate and assess and make sure that what we're offering and what we're doing for the public actually meets the needs that are there. And I think that the COVID pandemic has really exposed some fault lines around our mental health care and isolation, especially of our elderly populations. And absolutely, those are things that impact the public's health to a degree that we probably haven't paid as much attention to in the past as maybe was warranted, but with, you know, the pandemic having brought forth these issues just in such stark contrast, I think that this is the perfect time to start reevaluating and figuring out, is this the, you know, perhaps this is something that does need to be a priority going forward.
Okay. Thank you.
For question 4, we'll go to Ms. Wise.
Hi, Jeannie Weiss. So beyond COVID-19, what are some of the greatest threats to public health within an urban community? And what do you see the role as the county health director in helping to address those threats?
Great question. And of course, I already forgot the first part of it.
What are some of the threats to public health
Beyond COVID.
COVID-19?
Absolutely. Well, I think COVID has, you know, like I said before, has really exposed some of those threats that already were there, and probably has worsened some of those issues that are out there. So really looking at the social determinants of health. So over the past year, we've seen people lose jobs where, you know, unemployment already was a concern. We've seen people lose housing where housing was already a concern. We have a number of issues that just really kind of were compounded through that. And those issues were already there. They were already things that public health knew about and wanted to have an impact on, especially from a policy standpoint. I think they remain some of the greatest threats. I think racism is one of the biggest threats to the public health system, and I was thrilled to see that declarations had been made in Omaha to address that issue. Because if we are not offering health and a way forward for everyone, then we are never going to be a healthy community. Community implies that everyone has the same opportunity to be healthy. So I think that going forward, it's important that we assess where we are. We assess what's the status of the community. I don't think we know yet what the impact has been, how much worse have those threats become, and what are the evidence-based methods that we could apply to address those, and also listening to the community, listening to the people within the community to understand what their needs are, to understand what they're experiencing, so that we can best serve them and give them exactly what it is that they need to be healthy in the community. And our role as the health department, and my role as the health director, is to make the connections in the community and to foster the relationships in the community to really push that forward, because public health can't do it by themselves. You know, it's a small piece of the community, but it's an extremely important piece of the community, and something that we excel in is really pulling in stakeholders from all over to really build a safety net around our community and lift everybody up.
For question 6, we'll go to Dr. Wilkin.
Welcome back to Nebraska
Thank
and to
you.
Douglas County. What experience have you had in integrating federal programs and/or grants through collaborating with area stakeholders?
Great question. One of our biggest funding sources in Wyoming public health nursing is TANF, and that's Temporary Assistance for Needy Families, for those who may not be familiar with that acronym. And that funds most of our, well, I would say about 3/4 of our work in home visiting and maternal child health services. And that requires a great deal of collaboration with the Departments of Family Services, both their administrative staff and also their field staff across 23 different counties, so that can become quite challenging. And also it requires us to be able to work with area stakeholders across each of those communities to ensure that the families that we are offering TANF eligible services to are referred into other services, because the goal is to have families grow and become more resilient and not need the TANF assistance anymore. So that is federal funding that comes to the state, and we basically redistribute that through the counties, and then we oversee how home visiting and maternal child health services are happening in each of those communities. So you can imagine across 23 communities, there's a lot of collaboration that ends up going into that. We also get federal funding for plans of safe care, and that is a newer effort that we have been working on, and that has really pushed our growth in terms of working with different stakeholders across communities to best build plans of safe care. For those of you who aren't familiar, plans of safe care are a way to address substance use impacted moms and their infants, and to basically create a safe way for those children to be taken care of should their family relapse into substance use. And so it takes an incredible amount of collaboration across medical systems, mental health systems, the Department of Family Services, public health nursing, pediatricians, just a number of stakeholders in order to make that work happen. So most recently, quite a bit of experience with federal dollars and collaborating across multiple stakeholder groups.
Okay, I'm gonna go a little out of order here and ask Ms. Espinosa for number 7.
Dr. Huse, as we know, during COVID and our pandemic, community health workers have been critical to the work of reaching underserved populations. How do you see the role of community health workers play in Nebraska to serve our diverse community, especially the English as a second language speakers?
Thank you. Community health workers are vital to public health. There has been some controversy about the use of community health workers in public health, and I absolutely support them. There is plenty of work to go around, and the beauty of community health workers is that typically you want them to come from the communities that they're going to be serving. And so, first of all, they know how to communicate with the populations that they're serving. They're also able to build trust and relationships with their communities and really build that bridge between the public health system and the people. And so I think that community health workers are absolutely vital to the efforts that we have. We don't have them in Wyoming, and when I was at Lincoln Lancaster County and when I worked for the military, we didn't have community health workers, and there were so many times that I wished we could have had just that level of help and knowledge and assistance with reaching different populations and really bringing that information back so that we're able to do a better job of offering services, because sometimes we think we know what the community needs. We can read some articles and some journals, and we can think that we are hitting the mark. And if you're not actually talking to and working with the populations that you're serving, you could be way off. And so community health workers are just vital for really understanding and reaching those populations that they're serving. Thank you. I have had some. We do have a few FQHCs in Wyoming, and while public health nursing in Wyoming does offer quite a few clinical services, our FQHCs are absolutely vital as medical homes for much of our population. And so obviously these are institutions and organizations that are vital to serving our community and ensuring access into healthcare services. I think that in this position, the most important thing is to communicate frequently and to work closely to ensure that we are actually providing access to the services that are necessary for the populations that are served by those FQHCs. That can involve a number of different discussions on a number of different levels, but really what I have found throughout my career is that communication and connection are two of the most important things for building trust and for pushing forward the work that we want to do. So in my role, I would envision really developing a strong and solid trust partnership with both of the FQHCs here in Douglas County, and really just working hand in hand to make sure that we are assisting them where necessary, hearing feedback from them when we need to hear feedback, and just really making sure that that partnership and the communication lines and those connections stay very strong.
All right, Commissioner Rogers was reading my mind when he skipped and had me handle this one. Good morning, Dr. Huse.
Good morning.
This one has to do with the National Incident Command System. So are you familiar with the ICS system? And if you are, do you feel a unified command approach is necessary for larger incidents or outbreaks? But if you're not, would you be willing to get certified in, there's a series of lower level classes, and then there's 2 management level classes as well.
I've taken all of those classes. So yes, quite familiar with the incident command structure, and have been really integrated into ICS work and preparedness work my entire 20 years in public health. So when I worked at Lincoln Lancaster County, the emergency response coordinator was actually embedded in the same unit I worked in when I transferred into communicable disease from the juvenile detention center. And really, we, even as nurses, worked extremely closely with that program. We exercised the ICS structure almost constantly. Everybody was very well educated in that. When I transitioned to working for the military as a civilian, that ICS structure is just kind of already built there. And I was there during H1N1 and kind of I wasn't the incident commander because I wasn't the commander, but I was embedded in that system and played an important role there, and also interfaced with the community that we were attached to. So Fort Carson is attached to Colorado Springs, and so throughout H1N1 it was vital that our ICS structure and their ICS structure, even though they were separate, were working together very closely. I think unified command, especially in a pandemic situation or in a public health emergency, is a great way to address, because it's not just one agency that is necessary to leading that response. And having a unified command really ensures that all of the players really are connected and hopefully communicating well and following a structure that's going to really effectively address whatever it is that's happening. There are times where maybe a unified command structure doesn't make as much sense if it's a smaller issue or if it's very specific. But if you're talking about impacting the entire community and it's a public health issue, ensuring that you have all of your stakeholders at the table, and especially in that leadership structure, I think is very important to ensuring that you're taking into account all of the different community needs that are likely to occur. So yes, very, very familiar with ICS, and I won't even go into the use of ICS for COVID other than to say that we implemented it in 23 different counties, and so I was overseeing the staff that were implementing that in 23 counties, so that was fun.
Dr. Huse, let me follow up with 10 then. Walk us through your approach or process in addressing an impending emergency like an epidemic, pandemic, and who did you have at the table of those situations, or would you have for an impending emergency?
That's a great question. Thank you for that. So epidemiology 101, field epidemiology 101 is first verify that you have a problem. So if we have an emerging threat, an emerging infectious disease such as H1N1 or most recently COVID, it's really important to start gathering your data and understanding what really is going on, and is what you think is going on actually what's happening. And so ensuring that you really understand the situation, because your response is going to really depend on that. Early and very clear communication with stakeholders is very important. So bringing together your health systems, your Board of Health, the leadership in a community so that everyone is on the same page in terms of what is happening is absolutely vital. And your public health staff are going to be, you can't ever respond effectively without excellent workers. So hopefully you've been building up and strengthening your public health staff and workforce prior to anything like that happening. So if you've done it right, you've been exercising to respond. You've been doing real world exercises. You've been doing tabletop exercises. You've been reviewing plans. And in a perfect world, everybody just goes into response mode. From a leadership standpoint, really just making sure that everyone knows their role, everyone knows where they're supposed to go and what they're supposed to do, overseeing that, and then handling really the leadership within the community in terms of what needs to happen next. I believe, and I have seen what good communication does for a community in an emergency situation, and I believe that frequent and clear and transparent conversations about what the public can expect, what's happening, what kind of response is being mounted against that is absolutely vital to ensuring that people feel calm, people know that they're going to be taken care of, and that they're going to know and be told, here's what happens next in the process, here's what you can expect. Communities function so much better when we trust them to have that information and to really build that trust with the community ahead of time. So when that does happen, they know they can rely on you for whatever information's coming forward.
Number 11, Ms. Wise.
Throughout the pandemic, many of our large stakeholders, the health systems, school districts, et cetera, have thought that the relationship that they had with the health department was very positive and realized that that strength of relationship was vital to the success that we've had here in the county. How can the communication and related connections that have been made throughout this process be maintained and maybe even improved post-pandemic within the county?
That is such a great question, and it's very encouraging to hear that you've had great stakeholder involvement and support throughout COVID, because there's just no way that you get through something like this on your own. You can't be a siloed agency. It really does take having great relationships with everyone really in a community. And so maintaining those relationships absolutely is vital. I am a huge believer in relationships and just the importance of those connections. And to ensure that those go forward, I would make those connections early, personally, with those systems, and ensure that we are staying in communication and talking about what's the next step, what do you need next, what makes sense to serve the population next. And keeping all of those stakeholders at the table, because you're absolutely right. Sometimes you get through a crisis and kind of those relationships get a little bit less attention than they did before. And pandemics happen, public health emergencies happen, and if you don't maintain those connections and those relationships, even in, I guess you could say, peacetime, when something happens, it's going to be a lot harder to build those relationships back up in that environment than to already have them established. So in my role as the public health nursing supervisor in Wyoming, building relationships has been one of my strengths. And throughout the pandemic, I have had the joy of connecting with a number of different state agencies, local partners, and really using my ability to sit and listen to them and hear them talk. An example I would love to share with you. So I went to an incident management team meeting in one of my counties that I oversee, and it had been somewhat contentious. The relationships there had been somewhat contentious. The chief of police was asking for a list of positive people so that they could be prepared when and if they needed to make a call to someone's house, or if they pulled somebody over, they could check a list and know, okay, this person is positive for COVID, and so I should take extra precautions. There were other people saying, no, we can't do it, and really, I came in as an outsider, and that was a little tough because I had a manager that typically handled a lot of those internal issues with her stakeholders, and I came in, and the meeting was going really poorly. And when I finally stopped talking and just sat and listened to what the concerns were, I was able to make the connections and see where the solution could come. And so by the end of that meeting, we had a great solution for the issue, and really ended up building better relationships in that particular community, which had been a struggle before. And listening and communicating they're just huge for building trust. And so, those are two things that I think are vital to making sure that those relationships continue moving forward in the future.
Dr. Wilkin?
How would you navigate disagreement between the medical community and public health issues?
Thank you for that question.
You're welcome.
I would hope I would handle it with grace. I really do believe that listening to all sides is important. Public health has their perspective. We have our framework that we operate from. We see that things should happen a certain way. The healthcare community sometimes sees things a little bit differently, and that is okay. But we need to listen to each other and really be open and vulnerable and have the courage to have those kind of hard discussions. I am not somebody who shies away from tough conversations ever. My staff like to laugh because if I have conflicts, usually what I do is make everybody sit in the same room together and talk it out. So if we're having conflicts between public health and let's say, one of the local health systems, my approach would be to call that local health system and really bring in the players and have a conversation about what's going on. And I need to have more understanding about what that issue is. I really need to listen and hear what it is they're actually saying. I probably will have my public health perspective that I'll need to share, and then I will ask how we can work on a solution together. I don't think that I have all of the answers. I don't think anyone in public health in a leadership role is going to have all of the answers. But the community probably has some really good ideas. If we just listen to our stakeholders, oftentimes I think that we can move a lot faster and a lot more efficiently for our populations if we just open our ears instead of our mouths.
Okay. Dr. Huse, we have one last question that was submitted to us from the stakeholders. So that is generally, give us an idea what would be your first priorities as Douglas County Health Director.
Thank you for that. I've done a lot of thinking about what my first priorities would be in this position, and I believe that nothing can happen without trust and good relationships. So my absolute first would be to know my staff and to know my stakeholders and really be building relationships with the people who I know are going to be vital to public health in every way moving forward. COVID also has not gone away, so it's important that I have a very solid understanding of where the response work is at this time and really where it needs to go going forward. So familiarizing myself with that and inserting into that process as soon as possible absolutely would be a priority. And then also just assessing how the workforce is doing. So as you can imagine, this past 15, 16 months have been absolutely brutal for everyone, not just public health, the public. Everyone has really struggled, but I don't know that we can really keep public health moving efficiently if we don't address the needs of our workforce. And so really looking at my workforce and determining what their needs are and making sure that they have support, because I'm going to need them as I move forward in this new position. Transitions in leadership are always tough, so there's a trust building process there where they're going to have to get to know me, they're going to have to get to know my work style, they're going to have to trust that I am actually making decisions that are good for Douglas County. And that involves being able to listen to them and really fulfill whatever needs they happen to have at the time. And also, once they're well taken care of, you know, they're able to then go out and take a much better care of the communities that they serve. So those are a few of my priorities. Racism is definitely one of the issues that I am very keen to address as the health director, and that would be at the top of my list as well. Really looking at, so we have these declarations, which is fantastic. But really looking at what does that mean in action. So we have the will on paper, and we have voiced the will to address it. But what are we doing in practice? So what kinds of policies do we need to look at? What kinds of personal work do we need to work on ourselves to identify and weed out bias? And really making sure that our department is one that is absolutely in line with what we have said we're going to commit to.
Okay. That's all we officially have received. So, Dr. Huse, I would, like to give you a chance to any closing remarks you'd like to make to the board and also to the public that may be watching.
Sure. Thank you for that opportunity. I appreciate that. So I really have been working toward a leadership role such as this for about 20 years now, and so this is kind of a dream come true to be able to come back to Nebraska, my home state that I love, and really have the opportunity to serve the population here, to serve the people who live here. My husband and my son and I drove here last weekend just to kind of get a re-feel, I guess, for the area, since it's been a number of years since we've been back. And really looking around, we went to Cracker Barrel for breakfast one morning, and I took a moment to sit and look around the room and was just very humbled and honored that I would be considered to serve the people that were sitting around me. Very humbled and honored to have the opportunity to serve the people that I passed on the street. That's really what I got into public health to do, is to make lives better. And so to be able to come back to Nebraska and do that feels really lovely. I am so appreciative of the consideration for this position, and I know that, at least on paper, it may not have come through as much, but I know that my passion and my experience for public health really will benefit the community in great ways. I am bringing with me a lot of courage. I'm bringing with me the willingness to have really hard conversations with people that, sometimes people shy away from that. They don't want to have those hard conversations. They want to do what we've always been doing. That's not me. I want to have the hard conversations, and I want to do what's actually going to impact public health for the long term. I love the vision statement for Douglas County Health Department and the fact that they really drive for vibrancy. And that word brings up so much for me. And I believe that Omaha has absolutely the potential to be a vibrant and resilient community across the board, no matter where in Douglas County you reside, no matter what you believe, no matter what you look like, no matter who you love. I think that we really have an incredible opportunity to build that vision of vibrancy, and I'm so excited and so honored to be able to be a part of that. So I thank you, Commissioner Rogers, and members of the board for considering me for this position. So thank you.
All righty. With that, let me just know for the public two things. One, tonight at 5:30 here in this room, from 5:30 to 7:30 will be a meet and greet opportunity for the community at large to meet Dr. Huse. We've asked the public to submit questions in advance if you wanted her to address those. There's a few. There's still opportunity. You can submit those to me at my email, which is chris.r RODGERS at Douglas County NE as in Nebraska.gov. Depending on the questions that we get, the format will pretty much be an introduction of Dr. Huse, and it's a time to meet and greet. There won't be questions from the floor, but if people want to meet and greet and ask personal questions there, they can. Also, that's for the community at large. I also want to note Thursday night at 5:30 to 7 at Metropolitan Community College's South Campus on 2909 Bay Gomez Avenue, and it's Center for Advanced Manufacturing in room 120. The community at large is welcome, but just note this event is tailored specifically to faith-based communities of color and indigenous communities to get a chance to meet and greet Dr. Huse and ask particular questions in that same manner. As stressed, the board has made that commitment to addressing the structural underlying of racism, so we wanted to make sure we got a special audience for that, but the community at large is welcome for that. And again, if you have questions, please send them to me at that email. With that, we're officially adjourned, and just know for the public, just for information purposes, we meet a week as a Board of Health next week at 8 a.m. For the official vote, and then things will proceed from there. Thank you all for coming out. Thank you, Dr. Huse. We'll officially adjourn. You all are welcome to talk to the doctor.